The Honourable Speaker, the Honourable Prime Minister, fellow Cabinet Ministers, the Honourable Leader of the Opposition, Members of Parliament, ladies and gentlemen. Honourable Speaker, I rise to affirm the Ministry of Health and Medical Services full support and my full support for the budget. And I wish to commend the Honourable Minister for Economy, the Honourable Attorney General, Honourable Ayah Said Qayyum, the staff of the Ministry of Economy, who worked tirelessly, particularly during that week, even though we were hosting the Pacific Island leaders in the Pacific Island Forum, and also for the vision given by the Honourable Prime Minister, his decisive leadership and his willingness and urging all of us to be able to deliver not only in terms of the budget, but all the services, and encouraging all of us, whether we are ministers or assistant ministers or members of Parliament, to ensure that no one is indeed left behind. No. Our budget is 395 million. Sir, it is actually 413 million, because 17.2 million is in Head 50 for public-private partnership initiatives, such as the Lotoka Healthcare Fiji, the private partnership with GPs, free dental practitioner scheme, the private laboratory, radiology and outsourcing biomedical and laboratory services. Honourable Speaker, if you look at the budget book, it says very clearly what we have to do. We are going to ensure that we march towards universal health coverage. And this is Sustainable Development Goal 3, of good health and well-being. So we want to be able to ensure that we continue to strengthen our primary health care system, also ensure that our secondary healthcare system is actually stronger and more robust, but also our tertiary level healthcare system. And the tertiary level healthcare system is the work that's being done in our big hospitals at CWM and Lotoka, and more importantly now with Healthcare Fiji and the Triple P that's happening in Lotoka, where open heart surgery and radiotherapy will be available for all Fijians. Honourable Speaker, in primary healthcare, our major focus remains both in non-communicable disease and communicable disease, and ensuring that our children are given the opportunity of a good quality of life by being able to roll out programs such as our immunization expanded program of immunization, so that we can be able to mitigate against vaccine preventable diseases. Honourable Speaker, we are in the new normal, and the Ministry of Health continue to put emphasis on primary health care, because we found that working in primary health care, creating that surveillance systems, ensuring that we are liaising with our community health worker, having a zone-based approach to our to the whole Fiji, the whole of Fiji, that we can be able to identify and deal with emerging threats. There's been an allocation of more than $1 million for the National Health Center for Health Promotion, communicable disease prevention, non-communicable disease prevention, WASH, leptospirosis control, dengue prevention control. This is not including the support that we receive for development partners. Honourable Speaker, these public health initiatives will ensure that we treat and effectively manage emerging threats such as leptospirosis, typhoid, and monkeypox that we've seen have now become a public health disease of concern, and continue to work with COVID-19. In addition, we'll continue to resource more than 200 facilities and work with the community with our boots-on-ground approach to COVID-19 measles and LTDs. Honourable Speaker, back in 1995, the Ministers of Health in the Pacific, in their biennial meeting, met together and they set out a concept called the Healthy Island Initiative, where they agreed that our children are nurtured in body and mind, environments invite learning and leisure, people work in age with dignity, ecological balance is a social pride, and the ocean which sustains us is protected. We have found that in this intervening period with COVID, that these concepts remain true. And Honourable Speaker, a few weeks ago, the Excellency, the President, on the 31st of June, relaunched with genuine interest our healthy settings approach. Honourable Speaker, in this House about 2 years ago, I talked about the health promoting schools concept, where more than 300 schools in Fiji, for more than 1,000 schools, are now health promoting schools. You will see some of the signboards out there. We also have now setting out into healthy settings. So, for example, workplace organizations, because we found that OHS, there is a bigger emphasis on the safety component rather than the health component. And we've seen when this was launched, Honourable Speaker, there was a big uptake by government departments, corporate bodies that want to work with us. The next step is to move to faith-based organizations, to health-promoting communities. And we believe this is a way in which we'll be able to target specifically the NCD surge that we have and also communicable diseases. Okay. Honourable Speaker, with the secondary and tertiary healthcare, CW Hospital has $46 million allocated to it, $30 million for Lambasa. And as you're aware, Honourable Speaker, personal annulments, fuel and oil and oxygen are the major cost in running a hospital. But nevertheless, we will continue to ensure that we strengthen and not only with secondary healthcare but also tertiary level care, where there's a higher level of specialized care within these hospitals, and these may include some of the specialists that we already have, and also the specialists that we will have when Healthcare Fiji is running well on its own. Honourable Speaker, there's allocations of nearly $2.5 million for the purchase of equipment, but also we have to remember there's another allocation of $3 million for emergency radiology and laboratory services. I listened that Honourable Salater Ronda talked about that case that waited for CT scan. Honourable Speaker, with this $3 million allocation, we don't need to do that because we can then outsource it, for example, to Oceania or to another provider that has a CT scan in private practice because that allocation has been made available. Honourable Speaker, we have $1.5 million allocated for overseas referral, but understanding and knowing that Healthcare Fiji is now coming on board and during this transition period, this amount that is needed may actually over the intervening years reduce. We also have $300,000 that's set aside for medical teams. Honourable Speaker, there are medical teams that come nearly every week now that the borders have opened into Fiji. And some of them need transportation, need accommodation, and this allocation is provided to ensure that there is a seamless organization done for them. Honourable Speaker, we also have $900,000 set aside for early intervention directed to the Frank Hilton organization. This is a wonderful organization. With this, will ensure that they are equipped to support, to identify early children needing support and sustain a program to help them, including mainstreaming them. One of the successful programs that we've been working with is identifying and treating deafness in children, and also the wheelchair program for disabled children to ensure that there are robust wheelchairs that can be able to withstand the needs of our geography and also our environment. We have $2.25 million set aside for emergency evacuation by air from rural and maritime areas. Honourable Speaker, I remember the days when I was a young doctor and this allocation was smaller and there were times when patients were needed to come urgently, but we didn't have enough providers or we didn't have enough funding, and therefore they had to wait until the next boat. In some instances, some of them did not make it. If they arrived, they were too late. Honourable Speaker, that does not happen anymore because we now have several providers that that tender and provide that service for us, and this budget is all throughout Fiji to ensure that if any Fijian in a rural and maritime area that has an emergency and needs to come over very quickly, a doctor and a team will go over and pick the patient up and bring them back. There have been instances over the last few years where a flying surgical team actually goes across and provides a much needed operation to save the person. In some instances, save the mother and the child of a baby being born by cesarean shakes. Honourable Speaker, $211,000 is set aside for the Fiji Albinism project and ensuring that no one is indeed left behind. Because we know apart from the social and psychological challenges that albinism may pose, but there are indeed some significant medical issues that needs to be looked after in those with albinism, including the fact that they have challenges with skin diseases and skin cancer. Honourable Speaker, with the PPP, with Healthcare Fiji, in Lotoka, the Ministry of Healthcare Fiji Management are facilitating the gradual handover operations to the transition period. I've alluded that $13 million being set aside in Head 50 to be able to help support that, apart from the fact that $28 million has also been appropriated for Lotoka Hospital in its operational cost. And this is an increase from $780,000 from last year.
Okay.
Honourable Speaker, the Ministry led by my Permanent Secretary remains fully engaged in the discussion and site visits to ensure that the transition is smooth and seamless while maintaining full functions for the two hospitals of Lautoka and Ba. We have continued as a government to provide salaries of all workers who are yet to make the transition, and those who do not choose to join Healthcare Fiji will remain and be redeployed within the Ministry's health facilities. We looked at opportunities for them to be able to strengthen some of the work being done in Singatoka, for example, or in Tauboa subdivisional hospitals. Honourable Speaker, members of the public from Lautoka that go to Lautoka and Ba will do so at no cost, as currently the practice. Healthcare Fiji will be responsible for all aspects of delivery of services, and some of the changes can look forward to result of this PPP include the commissioning equipment fully functioning of the newly constructed Ba Hospital, which is actually continuing through its working and functioning, but they're continuing to put in new equipment as we speak. The undertaking of an initial fix of the Lautoka Hospital infrastructure is sufficient for it to provide appropriate support to service delivery. Construction, commissioning, equipping of new facilities at Lautoka Hospital as they come online. Implementation of a new ICT system that features patient management administration, enhanced communication facilities, financial management and building management. Construction and commissioning of a 100-bed staff accommodation facility. The provision of open heart surgery and later on radiotherapy. That the achievement of accreditation international standards for the services delivered to both hospitals that are involved in the PPP. These actions will continue to strengthen and enhance the integration of Healthcare Fiji facilities with the other healthcare providers in the Western Division. We are confident that with the PPP, what it will bring into the healthcare service Fiji is a brighter and better future for health in Fiji. Honourable Speaker, we have set aside in the budget about $2 million for maintenance works in our hospitals, subdivision hospitals, health centres and nursing station. Again, as I've alluded to, this does not include some of the funding that's available that's coming through donor support. Honourable Speaker, in Head 50, $2 million is set aside for the, as I've alluded to, the maintenance of all health facilities. But there are some payments that we have outstanding, like the upgrading works for Lautoka Theatre and X-ray Department that has to be paid. In this budget, there is $2.2 million for the Labasa interior renovation, and the beginning of work at some hospital, which is $2 million, which is for the initial stage of land stabilization and for the refurbishment. We are committed to the upgrading of these new facilities, and as I've discussed in Parliament also earlier, Honourable Speaker, some of our nursing stations have been changed and they've been upgraded to health centres with a nurse practitioner. And in the case of Tawana Withomba, even a doctor is now available there. Honourable Speaker, in response, Honourable Senator Loli marked that IT connectivity for health facilities. I need to point out that government has allocated in this budget $1.3 million for ICT infrastructure and network for the purchase of hardware network infrastructure. In addition, we have support coming through World Bank to be able to support us with the new connections. Honourable Speaker. Honourable Speaker, recently we've installed and now it's functioning the recompression chamber at CWM Hospital to the tune of $680,000. We have funding available during this budget, and we are thankful to the Minister of Economy and the Minister for giving us funding so that we can continue to train practitioners to be able to provide treatment for those who have decompression illness. Honourable Speaker, the free general practitioner scheme has been talked about in detail by quite a few of my colleagues, but sufficient to say that $1 million has been set aside and there's now 38 GPs. And I've talked to a few of them, and they're very excited to be part of this program. As you know, a lot of our general practitioners began their service within the civil service, and at some stage in their career they were looking at ways to be able to contribute back to the civil service, and they find that this works well for them because they're able to do that, and by contributing to nation building, by seeing Fijians, ordinary Fijians that come through their door, but at a cost so that they be able to, their businesses can remain viable. Honourable Speaker, as alluded to by the Honourable Minister of Economy, there is an incentive now for GPs to establish new clinics in rural areas like Nawithomba, Malolo, Rasa San Beto, Senganga, Nasarwanga, Korlewu, and Civikava, to name a few. Honorable Speaker, we also have 500,000 set aside in the new budget for the dental practitioner scheme. This is the private dental practitioners. And again, there's a lot of excitement within the oral health community of the ability to be able to also contribute in this area. Honorable Speaker, there's been some discussion this week about the Nasidi Koro, community health worker. And we have $3 million set aside for the 1,582 community health workers on Nasidi Koro. What we do is every working day, there's an amount of money that's paid for them. So all of them do not necessarily receive their wages on a particular Thursday that civil servants will get, because there are certain times during the week in which the payments are made. And it is dependent on ensuring that the paperwork comes through and is seen and processed. And we've also worked hand in hand with the Ministry of Economy to ensure that this process becomes simpler, so that they'll be able to receive their due when it's due. What we do know is that this program, since we've started incentivizing the community health worker, the decision by the Honorable Prime Minister has ensured that we have a stronger foot on the ground in our communities. Not only that, but since we started having community health workers being incentivized by allowances, we have had more community health workers. Because even in places in the Laminosori corridors, some of these informal settlements, we now have community health workers that are on this scheme and that actually receive allowances. And so we liaise with them. They are our hand and foot on the ground. They do their surveillance, they identify those who are unwell, they tell their zone medical officers and zone nurses, and we see that this system is working very well. And this had started before COVID-19, and one of the strengths of our response to COVID-19 and also the response to the vaccination campaign was the work of the community health workers, and I'd like to thank them at this juncture. Honorable Speaker, we've talked about how social determinants of health are so important. As a Ministry of Health, and with my senior officials in the Ministry of Health, we are so pleased to see the work that's being done in other areas, the infrastructure works, the roads that are being built, the bridges, because these all contribute towards the social determinants of health. Because when there's access by roads, then people can come to our health centers. We can be able to go and visit them. We're also thankful and we are grateful that the budget also sets aside a significant portion for social protection. Because this social protection will ensure that any young children, there's 3 young children in the family, they have a mechanism for their parents to be able to ensure that they have a good diet, because there's obviously that $30 a month available to be able to use that for their good diet or take them to the hospital, for example, when they are unwell. These all contribute to a healthy society. It's just not health on its own. So in a way, these are all indirectly affecting health, these social determinants of health. The access to roads, the proper water supply, the water sanitation and hygiene, and a few others. Honorable Speaker, before I finish, I just also want to say that throughout the COVID-19 pandemic, the government, led by the Honorable Prime Minister, showed that we cared for our civil servants by ensuring that their salaries were never touched. There was suggestions to cut their salary by opposition by 20% up to 35%. We never did it. Not only that, but we restored the allowances, maritime and rural allowances, and the overtime, beginning with nurses with the supplementary budget in the beginning of this year, and now for the other technical officers within the Ministry of Health up to Band F. And this is a true sign of the government's putting the civil servants first and understanding the important roles they play in health in Fiji. Honorable Speaker, I want to finish on just on 2 things before I sit down. I know the first bell is rung. Throughout this week, Honorable Speaker, this is now my 4th or 5th budget. One thing that's become very clear to me is whenever we have a budget debates, the opposition hasn't ever come up with an alternative budget. Never. They've never even told us in an alternative budget to hear, hold on, I've never heard a leader of the opposition or one of the leaders of their party stand up and say, we are going to have a budget of $3.2 billion. We will get $2 billion from this, and this. We will loan 1 point something billion. They never have. They've never even told us how much they will set aside for health itself. They've never told us. And throughout this week, all we've been hearing, Honorable Speaker, is the same complaint. It is not easy to be able to balance a budget. It's not easy to be able to ensure that a budget is provided that sees to all Fijians. We've heard about from the opposition, we want budget for the Itoke. We want budget for only for the sugarcane growers. We want budget. This government creates a budget for all Fijians. All Fijians. All Fijians are affected positively by the budget. And this is, again, another sign that we truly put Fiji first. And I request the opposition, because it may be the last time for a majority of them to be here in Parliament, that before they leave this parliamentary sitting, to reflect on the fact that they've never given us an alternative budget, because a truly functioning opposition will do so. I thank you, Honourable Speaker.